You know, one thing that we talked about at the beginning of the pandemic crisis was the fact that a lot of patients with other issues other than COVID were not heading to the hospital, and it may have racked up quite a toll on the health of many across the country and across the world. But don't take my word for it. Let's talk a bit more about it with cardiologist Dr. Fahmi Farah this morning. Dr. Farah, great to have you on. Thank you for joining me in Memphis. How are you?
Thank you for having me. I'm doing well. It's a pleasure to be here.
Well, I want to ask you about, I guess, stress and COVID-19. At least here in the Memphis area, many of the hospital beds, the ICU beds, were reserved for patients with COVID-related illnesses. And with that, many people either just chose not to go to the hospital or were told basically you've got to wait or go elsewhere for your symptoms. And some people paid a price for that, didn't they?
Oh, yes, that is correct. During the months of the pandemic for the last several months, we've seen a steady decline in patients coming into the emergency department and to the hospitals in general for conditions other than COVID, especially for cardiovascular causes such as heart attack and stroke. For example, the CDC had stated at the end of June that we saw as much as 23% decline in emergency department visits nationwide for heart attack and as much as 20% decline in ED visits for stroke, which has huge implications for our population because, heart attack is a time-sensitive manner. Typically, there's a 90-minute window from a patient having a heart attack to us actually getting into the artery and opening it up. It has implication for survival as well as complications down the road. So when patients are not showing up to the hospital in the setting of a heart attack, it really can jeopardize their life. It can be fatal in many instances. And for those who survive the heart attack and not receive treatment in a timely manner, they can face serious complications down the road, for example, heart failure, and have decreased quality of life. So it is very important for everybody to go to the hospital and emergency departments for acute conditions like heart attack and stroke. There are two main reasons why we believe that people have been fearful of going to the hospital. One, of course, is the virus itself. They've been fearful of possibly contracting the virus if they go to the hospital. But the other reason we think that the visits have declined is because the patients were just afraid of being a burden on the healthcare providers because they knew how full the hospitals were, which, is much better managed now. And as far as contracting the virus goes, I want to give a very special and important message to all our listeners in all communities that, all healthcare communities, including outpatient and inpatient settings like hospitals and clinics, have taken very great measures in implementing procedures and processes to eliminate the chances of contracting. So it's very safe to go to the hospital to receive necessary medical care. And so my advice would be to not delay that care.
Dr. Fahmi Farah joining us on Memphis Morning News. And you expressed it in no uncertain terms. Go get the medical care that you need, the limited window if a heart attack were to strike. And we're finding here in our county, at least according to the numbers that the health department here is putting out, that about 3 in 4 of the every four of the COVID deaths that are reported here have at least 3 out of every 4 have a comorbidity of some sort of a cardiac disease or cardiac issue. So what we've been saying here is that obviously COVID is very real. And while the CDC has recently said that 6% of the people that have died strictly from COVID, there's a lot of people who may have underlying conditions where COVID may kickstart that issue and exacerbate it.
That is correct. That is absolutely correct, because for people who have underlying conditions such as heart disease or even risk factors for heart disease like diabetes and hypertension, they are at increased risk of having complications as a result of COVID. A lot of them are facing fatality or serious complications like cardiac arrest, heart failure. Additionally, even for those who do not have underlying heart conditions, COVID is causing heart problems. We are seeing COVID causing inflammation of the heart muscle, which is known as myocarditis, which is affecting even young population, such as our athletes. And we're seeing patients going into heart failure as a result of COVID. So both the people who have underlying conditions and those without having underlying conditions are affected from a cardiovascular standpoint as a result of COVID. But for those who have underlying conditions are definitely at higher risk of having complications from COVID. So it is very important for everybody, not just people who are having heart attack in the acute setting, but those who have underlying conditions to stay up to date with their medical treatments and to see their doctors routinely to prevent complications.
Dr. Farah, that's terrific advice. If I may ask you one more question, and I know that there's no vaccine, there is maybe no one correct answer or a catch-all for everybody. But for just the general audience out there, maybe they don't have a cardiac condition, maybe they do. What's one general piece of advice that you could give to people regarding any kind of nutrition or any kind of other advice? Everybody says wear a mask, but what else should people be aware of other than that and social distancing?
Yes, other than masking and social distancing, it's very important to take preventative measures for your cardiovascular conditions and other conditions in general. So eating healthy is absolutely imperative. We know that since the pandemic started, a lot of people, it's difficult for us to go to the public and especially to the grocery stores. So a lot of people are buying foods that are not necessarily so healthy because they store better. They have more preservatives. I would advise against that. I would definitely say follow a heart-healthy, food habit, including more vegetables, fresh items, not items that have a lot of preservatives, and activity, like staying active and continuing with exercise. So those healthy measures are very important to stay in the best shape and to keep your immune system healthy during this pandemic.
Dr. Farah, thank you so much. This is things that even our own health department doesn't even tell us here. That is great stuff. Thank you for joining us. Stay well, and thank you for your insight and your time, and hope you have a great rest of your week, Doctor.
Thank you so much for having me. It was a pleasure.